Mr. Chairman, Madam Ranking Member, and members of the subcommittee, thank you for the opportunity to submit my written testimony for the record. I'm accompanied today by Dr. Stephen Hunt, who flew overnight to be here today because he didn't want to cancel his clinic appointments yesterday, Dr. Maureen McCarthy, and Dr. Gavin West, as well as Mr. Tom Murphy. The three physicians I just referenced have extensive experience treating Gulf War veterans. Mr. Chairman, this is our message. VA has learned a great deal about identifying, diagnosing, and treating Gulf War veterans over the past 22 years. We will continue to improve our abilities to provide world-class health care for Gulf War veterans, better educate our health care providers, and possibly most of all, in reference to the speakers that preceded me, expand the evidence base for the treatments we provide for these veterans, indeed for all veterans. Let me provide you with a summary of where we are. You know, we agree with Dr. Steele. As you know, a debilitating cluster of medically unexplained symptoms affects many Gulf War veterans. We refer to the illness that these veterans have as chronic multi-symptom illness, or CMI. Our present thinking is that a complex combination of environmental exposures and individual genetic characteristics may be behind this illness. Veterans with CMI, like all veterans enrolled for VA care, receive personalized, proactive, patient-driven care. In addition, VA offers a number of programs and services uniquely designed to meet the needs of Gulf War veterans with CMI. VA links our patient-aligned care teams, or PAC teams, working with Gulf War veterans with specialty care capability that focuses on treating the unique health requirements of these veterans. The program includes teaching aids, referral networks, and other types of collaboration. Frontline clinicians have been educated through a monthly community of practice conference calls, informational messages, pocket cards, and websites. Another program specifically for Gulf War veterans is our registry program, which offers a health examination at any of our health care facilities to any veteran with Gulf War service. To date, about 130,000 Gulf War veterans have undergone a registry exam. The comprehensive health exam includes an exposure and medical history, laboratory tests, and a physical exam. VA health professionals discuss the results face-to-face with veterans. This provides us an opportunity to partner with the veteran to develop an individualized care plan. An individual is very important to this discussion. Since 2001, the War-Related Illness and Injury Study Centers of the VA Office of Public Health, known as the RISCs, have supported specialized care for Gulf War veterans and conducted cutting-edge research, clinical education, and a veteran referral program. VA's three RISCs have teams of clinicians ready to evaluate Gulf War veterans with deployment-related concerns. Based on a comprehensive evaluation, the RISC team develops an individual, holistic treatment plan for veterans with CMI or other ill-defined conditions through a referral process based on geographic location. VA's Office of Public Health holds quarterly conference calls with environmental health coordinators and clinicians throughout VA. The calls provide coordinators and clinicians with ongoing training and allows them to share patient questions, challenges, administrative issues, and solutions that have come up at their facilities. VA recently engaged the Institute of Medicine, as you heard, to convene a committee to comprehensively review, evaluate, and summarize the available scientific and medical literature regarding the best treatments for CMI among Gulf War veterans. The report, as you heard, was released on January 23rd. IOM made recommendations to VA in 5 categories, including how to treat CMI, how to improve in systems of care and management of care, how to provide information about care, improve the collection and quality of data, on care outcomes and satisfaction with care, and how to conduct future research. VA is already taking actions, and these include a program to provide every service member with a healthcare assessment upon separation from service, improvements in systems of care and management of CMI in Gulf War veterans, including the use of clinical reminders and streamlined consults for specialty care, and the innovative PACT program I described earlier that integrates and coordinates personalized care for Gulf War veterans. We are improving communication among VA health providers and between them and the patients they care for. We are modifying our patient satisfaction measurement tools and training our staff to better recognize CMI. We are also developing a champions program and webinars on this subject and taking steps to strengthen our research protocols. Mr. Chairman, we appreciate the opportunity to discuss with you this important issue. We are proud to continue evaluation and treatment for the 700,000 deserving men and women who served in Operations Desert Shield and Desert Storm. My colleagues and I are prepared to answer your questions. Thank you.
Thank you, Dr. Davey. Is Gulf War illness a psychological condition?
Gulf War illness is not a psychological condition. Gulf War illness is a group of chronic multiple symptoms. We do not believe that it's psychological.